I think it is your job to call us to order. So if you would like to do that.
Okay, I guess we need to check for attendance of our executive leadership, the committee chairs, besides Jesse and myself.
And so let's run down. Oh, do you know, can you call them all out?
I was just gonna see if Gabby can tell who's online and give us a quick update, or we can do it verbally. I was thinking it might be quicker if Gabby has an idea or can see that. I'm not sure.
There's 80 people on there.
There's 80 people. So we have Kelly Roker in the
Dr.
room.
Roker's in the house.
Dr. Roker's in the house. How about John Pope? Are you on the line? How about Karen Hill as our past chair? Are you on the line? Crystal Smith? If you guys are sending it to me in the chat, I'm sorry, I'm missing it. So just speak up if you're on the line. So lastly, Jessica Mantooth, I know she is actually having to teach TNCC and will join us at 2:30.
And Kelly will be here.
Kelly Vaughn is here. She's just down the hall, so we can count her. So that's a quorum, right?
I know Crystal had the stop the bleed.
Yeah, they've got a big thing going.
Yeah, I think she was gonna be just a little bit late. So then we only need,
You can still do your agenda. you
Kelly.
just-
I'm here too. Sorry, this is Danielle, one of the trauma piece.
okay, hey. Welcome.
So
All right,
I'll
Tracy,
say
I'll-
that we have a quorum and we'll get the meeting started.
Awesome. All right, Tracy, thank you so much. And thank you guys for joining today. It looks like we have 86 people on the call and there's probably another 10, 15 in the room. So thanks to those who could, who were close enough by to come here to Madison, Georgia today. It's my first experience. They just took me out for a very good lunch, so that was lovely. So do we have anyone new to our group here in the room? We'll start in the room and then we'll go to the call. All right, no one new in the room, but we did just see John Pope arrive to the room, so that is another executive member. So, all right, how about any new members on the call? Christy, have you been to a meeting before? Sorry.
Hello, I'm Bill Briggs from Wellstar North Fulton, the trauma program manager.
Oh, welcome. And you said Phil Briggs?
Bill, B-I-L-O.
Bill. Okay, thank you, Bill. Welcome to the group.
Thank you.
Anyone else on the call?
This is Tom Hicks. I am the Executive Director of Nursing for Trauma, Burn, and Critical Care at Cobb Hospital.
Good to have you. And also Karen Hill is on the call, so I think we have almost all of our executive committee. All right, anyone else new to the group? on
Hi,
the
this
call?
is Catherine Brown. I'm a new trauma coordinator here at AMC.
Welcome to the group. We do have one in the room, Christy.
Yes,
Christy, tell us your last name and where you're representing.
Mathis, Christy Mathis, Morgan Medical Center.
Christy Mathis from Morgan Medical Center is here with us.
Hi, good
Anyone else?
afternoon. Hi, good afternoon. This is Becky Weidler. I'm trauma director with Nadira here at Northside Gwinnett and Duluth.
Well, hello, welcome to the call. Anyone else? I know it's hard to do this kind of intros over the phone, but it's going pretty well so far. So do we have anyone else? All right, well, welcome to the new folks and also for all of you who have been around for a while. So we'll go ahead and get started today. For those who I have not met, my name is Jessie Gibson. I've had the pleasure of being the chair of this group for a little bit over a year now. So nice to meet the ones in the room I have not met, and then those of you on the phone as well. So we will try our very best to bring up any speakers close to the microphone so that the experience for you guys on the phone is tolerable. But let us know if you're having any issues. And with that, I think we can turn it right over to Liz Atkins for our Georgia Trauma Commission report.
Thank you, Jesse, and welcome everybody. Again, I'm Liz Atkins. I serve as your executive director for the Georgia Trauma Commission. And we had a robust meeting this morning. So thank you for all in attendance of that. And I just wanted to put a shout out that I would love for you all to attend. And we have a virtual option for attendance of that. And we do it by webinar so that unfortunately you can't talk, but we have between Gabby, Katie, and myself and Gina, we monitor the chat. So we welcome comments and things. And sometimes people are a little less reluctant to put things in the chat than actually speak up. So I try to be active in the chat as well as chatty. I know we're laughing about that. But, because I want people like your input, all this infrastructure exists for you. So if we don't hear from you what you like, don't like, or what's working well, or your comments on items as they come up, it's really hard to know if some of these things are meeting your needs or not. So I've created, actually for MSAC, I created like a nice summary of all the big projects that the commission's working on so that I don't have to bore you with all that. And I'm just going to submit it. I'll have Gabby put it in the minutes as kind of like an update, because there's a ton of like little offshoot projects that the commission's funding that you guys will want to keep track of and potentially participate in. But just a few things that came up from the commission meeting. And I would highly recommend, Gabby always posts the commission meeting packet electronically to the commission website under events. So call into the meeting if you can't come in person. We love to see your shining faces in person. Look through the packet, make sure you know what's going on, because it's a lot of stuff going on. We did have a lot of really good discussion this morning. And ask questions. Yes, ma'am.
I'm sorry to interrupt, but I forgot to ask for approval of the minutes that Gabby posted. So talking about knowing what's going on, we need to get several of those things taken care of so Gabby doesn't have 40 million documents open. I apologize.
That's good. Go ahead. Do you want to ask for?
Yes, so we actually did not approve the November or the February minute, right? In February, we failed to, that was probably an oversight on my part, Tracy. I don't even see it on the agenda. So if we can get a motion to approve first the November minutes, and all of these were sent out in advance.
This is Tracy. I make a motion.
And can we get a second? Kelly Roker in the room seconds that. Any discussion? All right, so the November meeting minutes are approved, and then the February meeting minutes from Barnsley, and also we had the phone call as well. Can we get a motion to approve those minutes? John Pope has made a motion to approve. Anyone else?
I'll
Anyone
second.
That was Tracy Johns. Any discussion? I feel like an auctioneer. All right. Sold. All right, both minutes are approved. Thank you, Tracy, for speaking up and ensuring that we took care of that. All right, Liz, back to you.
All right, back to me, back to you, Dick, right? I feel like we're talk show hosts. Okay, so a few of the high level things for the commission update. First, right off the bat, just let all of you from the level 3 and level 4 centers, congratulations, because you may not be aware, but while you were all at Barnsley at the welcome reception, I had Dennis roasting marshmallows, filling out a AAST abstract, which got accepted for main podium presentation. So congratulations, you guys, it's awesome. We're just the vehicles by which to get it through, and Dennis is a AAST member. So, you know, you got to have somebody who's like in the club to get in that realm. So Kelly Vaughn and Dr. Patterson are helping me with the manuscript. The manuscript has to be submitted first, and then the AAST, I can't remember where it is this year, but it's in the meeting's in the fall.
Orlando, I think. No, that's the east.
East is usually always goes to Florida.
I can't remember.
Chicago. I
Oh,
think it
that's
is
right.
Chicago.
You're right.
Which it's not too cold by then. You know, Chicago's only limiting factor is its climate. anyway, very exciting. And it just goes to show that, like, you know, East is very starchy, like academic. But just the fact that they wanted a piece of work like this on the podium means that there's people are starved for this information about level 3s and level. There's so much unknown about costs out there. So it'll be really exciting to bring that forward. And then okay, from the commission meeting, there was a discussion. I'm going to ask to tap into this group. We can maybe talk about this in St. Simon's or something. One of the commissioners, Dr. Dunn, asked this morning about we're very closely monitoring the super speeder revenues, because that's like, you know, that's our funding source. That's how you guys get your money. So Dr. Dunn asks do we do anything, any education with either our state or local police departments about where that money goes and what it supports? So I think that's a great idea. The Governor's Office of Highway Safety, as well as the Department of Public Safety, probably are good connections into like the state patrol. But those tickets aren't just written by state patrol officers. Super speeder can also be generated from like your local jurisdiction. So we probably could do well to enlist the trauma centers to do this as a form of outreach or whatever, and maybe create like an impact of funding sort of thing. Not that we want them to go out and write tickets, but like we want them to understand when they do that and they target these so-called high-risk people, which I contributed myself, I'll just say it. It's not going towards some like, you know, I mean, the money's directly getting back to those who take care of trauma patients. So it's not like the money's going into red tape up on the hill or something. It's going towards something. So more to come on that. We can work on a partnership and how we do that together.
Liz, is there any way we could get an infographic kind of made about that?
Yes, and we just found a company. Am I having flight of ideas or what, Gabby? Didn't somebody, or no, Gina, Jesse Codner said there was a company, or gave you a company that does those medical like infographics or whatever.
Well, you can use, yeah, they give you the little templates you can use
Yeah.
to create them, but.
Yeah, something really cute that's like a little one pager or something. So it can
Right,
go
'cause
out.
the individual centers could put those out, you know, like on their, whether it's internally or externally. But plus, if you put that in that little kit, that would be great.
Yeah, and it would be editable potentially for your own area or something that could highlight something about your center. That'd be awesome. Great point, great job. And then there was a lot of discussion around telemedicine and its utility. And I know in my previous life in the TPM role, we tried telemedicine, it failed miserably. They were like, we're too busy. We can't stop and get on the phone, whatever. But as we learned during COVID times, we may be much better served to try to keep people where they are and treat them, as opposed to taking up a high resource type of bed at like a level 1 or level 2 when those become a really hot commodity. So there's interest, and I see this maybe going through the TMD group to kind of figure out, and there was a lot, I had a lot of text messaging going back and forth. People are interested in seeing how this could work. There's a lot of confusion around the legalities, whatever, but I see this as being something that we might kind of take on in the future. And then very exciting, the commission voted at the recommendation of the level 3, level 4 rural trauma subcommittee to confirm that we are going to do the ACS rural focused system consultative visit January 9th through the 13th. And so what that means is, some of you are in the room, maybe you have or haven't been around long enough to know or to remember the original system consult that was done circa 2008. Jesse, were you born then? I don't know. No, it's probably most of you haven't been around for that, but we had a full system consult. But now what the ACS likes you to do is have an EMS system evaluation, which NHTSA, National Highway Transportation Safety, blah, blah, blah. They do that. They like you to have that first, because then they don't have to spend so much of their time on EMS. And it took a little while to get that NHTSA piece organized. So we decided, we asked the ACS if we could potentially be a pilot for a focused visit. And they were delighted at that idea and worked with the rural committee to develop kind of a framework of things that they would look at when they come in and do that. So they will be here in the state for a week, and they will have lots of stakeholder meetings, probably in South Georgia, in the rural area, and then also the rural areas of North Georgia. So they'll want to talk, they don't want to talk to like commission members and, you know, they want to talk to you or people in your facility and your, you know, they'll send us a whole list of people that they would like to have. But I wanted to get you guys the dates because I think you should start like publicizing this in your facilities. And, you know, obviously there still will need to be some involvement by the ones and twos because the rural system is only as strong as the system, as the tertiary system that can accept those patients. So that's really exciting.
Liz, can I ask a clarifying question?
Yes, ma'am.
About that? Will they be doing any work with the non-designated centers?
One of the things that we asked them to look at or to provide some feedback on is what, first of all, where everything's located. Clearly, we don't have enough like level fours.
Right.
We gotta sock the market with level fours. But what an incentivization process looks like. So yes, if you have good relationships with your referring facilities that are non-trauma centers in rural areas, we really need them at the table too. I know that's gonna be a hard sell, but it would be great. Mostly because we want to start engaging them because non-designated centers have a role in the trauma system, just not all of them really understand what that role is.
Right.
And the role is not to just wave off the MS patients as they're coming.
So we would provide that if we have a couple of rural centers who refer to us, we just provide you guys with those, maybe kind of connect you.
Or no, we would, I don't know all the logistics yet, but how I remember this was it was communicated what dates and locations the review team would be there. And so all those folks who are from those areas would show up at a meeting that would be held local today. So they could be, what they'll do is they'll have a big pre-review questionnaire similar to your verification visit, and they'll just start asking questions and having dialogue. And I remember I did participate in that with the 08 visit. Gina, you probably were around in those days too. Yeah. And then lastly, I will say that a request came forward from the GQuip Advisory Committee about, you know, given that Gina will give you an update on where Arbormetrics and the central site is for GQuip. And given the significant time and cost investment, the state has a free image trend patient registry. And we were a little bit concerned because Gina asked them about what the costs would be around making it capable to ingest image trend files, but it would be additional costs, which we don't have allocated for, and delay implementation. So I told the commission that they didn't need to make a motion. We would just include it, just like we did for your ACS verification requirement for funding eligibility, to just say, at least for the next 3 years, because that's the time frame we put on the Arbormetrics project. So we do like a postmortem on it and say, do we like it? Is it good? Do we stay with it? Whatever, at least for the next 3 years. And all of you are on ESO V5 for better or worse, but so we kind of need to stick with that until we get through this. And then as we're moving along, we'll kind of see what that looks like. So we'll just add that in your, because we need you to participate in that. So we know if it's worthwhile or not. So we'll add that to the contract language. And then those were kind of the things that came up at the commission meeting. Other things we're working on is adjudicating all of your PVP. And you're all going to get your, the commission approved the AFY budget and the FY23 budget, and everybody's getting additional readiness. So they also approved web hosting for level 3s and 4s. So if you're not already web hosted, you're going to get money through your amended contract to do that. And you're going to get the PRQ report writer package. And we're going to do a custom report package for level 4s because we realize you don't have time to be playing in your registry to figure out how to run reports. So we think we can do that all under the web hosting thing money. If not, we'll figure out another bucket to take that out.
Excellent.
That's it.
Does anybody have any questions for Liz? All right, very good, very good meeting this morning, and thank you for that report. Okay, next up is the Office of EMS and Trauma update, and I think Marie is in the room. I don't know if Renee and David are on the line, but Marie, do you want to go ahead and come up and do your part? I think that works fine right there, yeah.
Hi, everyone. I'm Marie Froch with the Office of EMS and Trauma. And Renee is on vacation, so she's probably not on the call for this meeting, but she was earlier today. And then Lynn, I think, is on the call with us today. Renee's been on the road a good bit, attending ACS site visits and holding some Georgia visits. She's lining up many 2 or 3, 4, 5, 6 level 3 and 4 visits. So she'll be busy for the rest of the year. And she's working closely with ACS to know the dates for the level 1s and 2s that are coming up in the coming year. So she wanted me to report on the OTCPE and OBCPE for quarter 3. So far, everyone has had their reports closed out except 2. And we're waiting on the trauma medical directors to sign those reports. So thank you to everybody that has gotten their TMD to sign. I know we kind of poke and prod, but these 2 are being a little sluggish. Quarter 3 completes the 2021 data set, meaning the data that you reported or confirmed was complete in the quarter 3 report finishes out the 2021 data. And so based on responses to the report, the record closure rate overall for the 33 centers is 82.4%. So we have over high achieving or highly effective closers, and we have not so effective closers. So the average is 82.4 across all 33 centers. And of the ones that report the surge in response rate, which are our level 1s and 2s and 3s, the overall response rate is 85% statewide over the 25 centers that collect that information and report it to us. So that's good to know. The next item I want to highlight is we have a DPH website. The website is dph.georgia spelled out .gov/trauma. And there we have the 2022 Georgia Data Dictionary, and we have updated it already with the fiscal year 2023 download and reporting schedule. So we will send that out by email as well, but if you ever need it, it's on our website. Regarding the fiscal year 2023 quarterly report, we'll begin preparing that in the license management system. And we'll use the new 2022 ACS standards and follow what items the Trauma Commission is using for performance-based measures so that we can kind of help them monitor and we'll know what's going on regarding the data and the regular program performance measures. Next thing is the Office of EMS and Trauma has met one of the GCTE goals of increasing trauma awareness by releasing the 2019 Trauma Registry Annual Report. So thank you everyone for submitting your data. Dr. Dan Lin Liu, our trauma epidemiologist, prepared the document and DPH has approved it for release. The document is primarily a demographic analysis from an epidemiologist's perspective, and it really mirrors the old NTDB report that we used to get. And I think the last year that was published by NTDB was 2016. Our GQuick group looked that up because we were curious how long it had been. So her report mirrors that. You'll see many similar type graphs and tables. One thing that is different is she included the time to definitive care study that we've been working on. So that is interesting to know. The again, that report is on the 2019 data, and what we're looking at now with the GQuick group, the April through June of 2021 data has a significantly higher hour time frame for ditch to door. Door to is what I mean, ditch to door to, by 2 hours actually. So COVID really impacted the data, and I'll be glad to get back to a more normal baseline, which we believe the 2019 data may present, which is 4 hours. So anyway, that annual report is on the Trauma Commission's website, and the revised copy is posted there with today's meeting documents. And the reason it's revised is because we realized figure 18 needed to be redesigned. So we fixed that, and so that's why there's a revised copy. If you have any questions about that, please let us know, or comments or ideas for it, please reach out. But the document can be used by the Trauma Commission, the Data Subcommittee, GCTE leadership, the Data Subcommittee, the Injury Prevention Subcommittee, the Registry Subcommittee to QA the data, and begin evaluating the data at your center. And we'll certainly will share it with our DPH injury prevention and codes partners. And Danlin, I believe, is already working on the 2020 data, which she has from our V5 CBS, CSV files. So she has that. The injury, the image trend patient registry central site is still in the pilot phase, and Mo is with CHOA is our primary pilot center right now. We're trying to get the files perfect so that the files can go to the other pilot centers, and then hopefully be smooth sailing. We've gone back and forth with image trend and ESO, and now the ball's in ESO's court. So we're waiting on updated files to retest the import. But CHOA was able to import into the image trend patient registry. It's just that some of the fields were missing data once it got into the patient registry. And between Mo and Jeremy Kendall with image trend, they were able to decipher in the code, and this is one of Mo's superpowers that nobody knows about. They were able to find the errors in the file that came from ESO. So we've sent it back to them to fix it. And so we're waiting for the new files. And where I'm pushing to get that pilot phase completed as soon as possible. And then the files can go out to all of the V5 users so that you can work with your IT departments to
Can you speak up a
install.
little, Marie? I'm sorry to bother you. They're saying they can't hear you online. Sorry. Or
Okay.
can we move the owl over to you maybe?
Okay, hopefully that's better.
Well, now they're not connecting. Well, now they're
Okay.
All right.
So as I was saying, I'm pushing to get ESO and Image Trend to wrap this up so that we can start resuming the downloads by the end of June or beginning of July, because we need to start receiving your data so we can move forward with our data analysis and working with the GQuick. I don't think I've forgotten anything.
Heather has a question.
Question. Right, and you may not know this yet, but just since it is being piloted, do we know what the training on the user end side of things? Like I remember when we had to convert files to ITDX and all of that, like, and then upload to the central site. I'm just wondering like how much time our end of it is gonna.
Good question. Once the pilot is finished and we know the files are good to send out to everybody, then I'll redo the training that we did with you guys, with everybody actually, and record it so that folks can access it anytime if you're not able to be online the day I do the training. But the process is really simple. We determined that in the initial setup of the transfer file, ESO had to have the users create an extra or go through another step to convert their file. Well, we backed up and told them, no, we don't want our users to have to do that. We want it to be very simple. So they have changed the format. So you won't have to go through that conversion, which will make it easier, and hopefully your IT departments, cybersecurity departments won't have such an issue with you uploading to a new central site, because there's no middle box, if you want to call it a box, to send that data through to convert it so that it goes in. So that's not in the step anymore. Altogether, Mo, would you say it took 15 minutes to do the
process is very
download?
Similar to what we used to have to do. I don't think it was really any more time. It's more like the two-foot process. You know, put a picture under aggregator and then go grab the file. You just need to know where the file went. That was the big hurdle.
The big hurdle, but it is similar to the
Very
T-Quit
similar.
download. Okay,
Very
so,
similar.
okay.
You do the file transfer from the V5, go find the file, log into the Image Trend patient registry, go through the different pages and upload it. And it will say pending, and you can log out and you're done. But do log back in later to make sure that the file was transferred successfully. It will tell you if there are errors and which records there are errors on. You have the ability to open up the record in the Image Trend patient registry to make the change, but that really is not efficient because the correction needs to be made in the V5. And then you can redo the download. And if a record has already been imported, the system will recognize that the record has come in already, and it will update those particular fields that were changed.
We're clarifying a question here regarding registrar training for this. In
Did
the
you
chat, sorry.
say something about registrar training?
Yes, once the pilot's finished, then we'll host a second
Okay,
training session.
Oh,
So
okay.
everybody can see it, and it'll be virtual, and you can, it'll be recorded also. So if you can't attend the online session, then you can watch it whenever you're available and know how to do the download.
all right, thank you.
Did that hit it for you, Colleen? Put it in the chat if not.
All right, was that the end of your report? Any further questions for Marie? And you guys, I did have an opportunity to look over the report, the 2019 Georgia Trauma Registry report, and it's nice to see all of the information in that aggregate form. So take some time to look at that if you have a chance. Thank your team for doing that, you and Danilyn and
Then Lynn put it together.
the whole team. All right, thank you very much.
Thank you.
And we're getting some text and calls and chats that the Zoom is now full. I think this Zoom account has 100 caller capacity on it. And so we will work through that for the next meeting. But for now, just share with anyone that's not able to get on the call that it is being recorded, and a few of the subcommittee chairs who weren't going to be able to join until later have already texted me, and so I have their reports that I can provide if they're not able to get on. All right, so moving on to the next report, Cheryl with the Georgia Trauma Foundation. Oh, there you are. I'm like looking for her. She's right now.
Afternoon, just want to update you all on a couple of things. You'll recall in the most recent report I shared with you during the winter meeting at Barnsley, I mentioned that historically the foundation's activities have been centered around education. So after speaking with several of you and what some of your needs may be, we have a project in the works now that we believe will really be a tremendous help to you. We're spearheading a continuing education database project. We're working on it with the State Office of Rural Health. And after the database is completed, what it will be is pretty much a one-stop shop for anybody who's trying to set up some continuing education courses. What you'll find in the database is you can search by course, because we're going to have initially probably 8 courses that you could look at. And what I mean is you'll be able to find ATLS instructors, ATCN, TNCC, courses like that. You'll be able to search by course. You can perhaps search by whatever faculty type you need. If you're looking for a coordinator, you could plug that in. If you want somebody who is located close to where the course will be conducted, you'll be able to find them either by county of employment, county of residence, or by an RTAC region. So there'll be lots of searchable fields in the database for you. And we hope that'll be more convenient for you going forward. Everybody listed in the database will be credentialed. Once credentials expire, they'll be removed from the database until they renew their credentials. So you'll be able to make sure, we'll make sure that that database is kept current for you. And we expect to have it up and online by the end of this year. Now, one of the things that I also shared with you at Barnsley is the fact that while we would continue to do things related to education and advocacy and injury prevention, that we were going to focus primarily on our philanthropic efforts or fundraising, because that's the reason why we were created, and that is to provide dollars to the state trauma system. So one of the ways that we're going to get to where we need to be is by working with a fundraising consulting firm. So we're going to partner with a group that's called Alexander Haas, and they're going to help us put the resources in place so that we can begin to really raise the funds needed to support the system, so that we can help you all with some of the things that you're trying to do at your individual centers. And then in addition to that, support whatever the commission itself is working to fund. That's it. Any questions?
Any questions for Cheryl? Lots of great work going on with Cheryl leading the charge. So thanks so much for that, Cheryl. All right, Gina Solomon, you are up for Georgia Quality Improvement Program.
Hi, good afternoon, guys. We have a lot of exciting things going on, and I know y'all are probably as anxious about arborimetrics as I am. Really excited about that project, and we have had some movement in the last couple of weeks. So arborimetrics has first draft of the contract. We're waiting for them to provide some feedback to us on that. So we hope we can get that contract tidied up. I'm hoping by June. And we can kick off that project. That'll be about a 21-week build for arborimetrics. But in tandem with that, we're building the ESO GQuIP central site. So it has about a 90-day build. So we have sent the first draft of that contract to one of the approval bodies GTA for that. So we hope to get feedback on that soon. So if all goes well, we're hoping to have maybe the central site up and going by the fall, followed by Arbormetric somewhere by the end of the year. So that would be awfully exciting to have some kind of data to show at the winter meeting. So I'm keeping my fingers crossed that keeps moving because it's going to be so beneficial to all of us. And just to tag on to what Liz said happened in the commission, we do have an advisory committee meeting made up of several of the TMDs at the centers. And one of the things, data is always a huge issue. We can't move anything forward in GQuIP without data. As y'all know, I ask constantly, it feels like, unfortunately, for y'all to share data because I do not have access to any. So this will help that tremendously. We can do projects a lot quicker because we as GQuIP will have access to data to do performance improvement on. So part of that though is, being able to have access to your data. So the committee recommended that the trauma centers participating in GQuIP stay on V5 at least for the next 3 years to make that process a lot easier. So we're looking at apples to apples with our data as we work on our data dictionary and those things. So that's exciting. The work groups, the AKI work group is really requesting another data pull from a report that we built and sent out back in 2016. I believe it's been that long ago. So I will be reaching out to a couple of folks to see if that report still exists, what it looks like. We may add a few things to it. And we're going to try not to pull any manual data points because we know that's even more work for you guys when we have to ask for things to be dug up out of the chart that's not in the registry. We did have our research resident, Jesse Codner, did a poster for GQuIP on our AKI physician practice survey, and it was accepted at the ACS Quality and Safety Conference coming up in July. So that is exciting. The TVI data pool, we have the data, and now we're working on how we're going to slice it and dice it with Jesse and Dr. Benjamin to get the most out of it. So thank you all very much for sending me your data, working with me on getting those reports built because we could move anything forward right now without you guys. Opioids, they're continuing work on a multimodal guideline. Dr. Kohler is eliciting some folks that have some expertise in that to add to what we have already completed. And we've also put together a VAP guideline review work group. The VAP guideline that GQuIP helped put together back in 2017. One of the things we got out of Barnsley was that most folks said, what VAP guideline? So it was a good time to look at it, to update it and reintroduce it. So there is a group working on that. We're also continuing to work with our special counsel with the AG's office on peer protection policies as well as data protection and privacy policies because we know that's important. One big clarification that came out of our work is that GQuIP will, and the commission is not a covered entity when it comes to HIPAA. We don't take any funds. We're not a payer. We don't work with anything like that. So we will have very robust policies regarding that to come. And then the summer meeting agenda, I'm very excited about that. I think we have some great things on tap. We actually had more things than we had time for, and I think that is fantastic. So that will help us as we move into the winter meeting planning, which will start very quickly afterwards. So we'll be sharing that agenda very shortly. And I think that's all I have.
All right, any questions for Gina? All right, thank you, Gina. Okay, so now we'll move into our subcommittee reports. And for those of you in the room, if you don't mind, John and Kelly, if you guys will come up close to the owl so that those on the phone can hear you, at least when it's your turn to speak. So we'll start with our education subcommittee, and I don't know, I'm gonna check one time, but I may be providing this report due to our Zoom issues. Jessica Mantooth, are you on the call? And Kendra, are you already off the call? I think so. I think she said so in the chat. So let me just provide a brief update for them. Luckily, I had their report to provide to the commission this morning, so I will share what I had. So the education subcommittee is working on several things. First, they're working on the education that they are going to provide us for transfer to definitive care. They have a work group within the education subcommittee that's focusing on this initiative. They've done a literature review and they've decided their objectives for the educational material needed. They've already created an outline and they're sharing that amongst the group and having some further discussion regarding if it's valuable to determine, or I'm sorry, they are discussing what injuries should require more rapid transport and what ones are less urgent. And so that's the type of stuff that will be included in that education that they're able to put out that we can all share with our referring facilities. Then they're also working on acute kidney injury. As we know, the TQIP report has shown that Georgia as a state and most of our centers, mine especially included, is a high outlier for acute kidney injury. And so they are working on some education to provide to our nursing and physician teams on acute kidney injury as well. And another thing that they have done and done a really great job with was they were given some extra funding not given, I guess there was some extra funding left over that they needed to help to allocate to some educational initiatives. And so they are funding an ATCN course at Grady on June 11th. They're funding a TNCC provider course at Phoebe Putney. And that will be scheduled later. I don't have the actual dates. There's a TNCC instructor course at Piedmont Henry. And they were also able to purchase the new STN e-library for statewide use. And so that's definitely a resource that if you do not know how to tap into, please contact Jessica Mantooth or Kendra and they can help you. I know at our center, we use that education to help train some of our nurses. So don't recreate the wheel. So that is the education committee report. And now we'll move to Dr. Roker for her pediatric report.
So we had our last meeting the end of April, and Kendra and her trauma medical director spoke a lot about pediatric readiness. They actually have a talk that they're ready to give at the summer meeting, specifically targeting adult centers to help them meet the requirements of the Gray Book. And we were brainstorming a pediatric readiness package that we could have ready by the summer meeting so that we can give it to all the centers if everybody thinks that that would be helpful. So we were talking about pediatric gun violence also. And I mean, as you know, pediatric centers and position on guns and gun violence is, you have to tiptoe. But Kendra and their trauma medical director have a project that they worked on that I think they're going to have some time to present at the winter meeting. And we're hoping that pediatric centers can join forces to brainstorm regional specific violence intervention programs. I don't know if anybody's participating in the TQIP GSW study, the gunshot study, but there's a lot of questions in there specifically asking what resources you gave patients as follow-up. And unfortunately at these PED centers, all of those boxes are empty because we don't have a place to send these kids. So we can send them to their psychiatrist and we can send them to DFACS, but that's it. Nothing for violence intervention. And then there was some discussion around the SIPA score, and we're going to try to work with the education subcommittee and the registry subcommittee to move the SIPA project forward. Currently, we're collecting data at the pediatric centers so that we can target specific education and information when we go to outside hospitals and talk about SIPA.
All right, great report. Any questions for Kelly and the pediatric subcommittee? All right, so now we will move to John Pope for an update on the process improvement subcommittee.
Okay, so this really stems from before, back at Barnsley. We've actually met twice since then. The push has been to actually make the PI committee a true PI committee. And so we've actually pushed out, we've got a good response. We have some decent membership and meeting now. That's actually been more than one meeting. So we've actually asked for a chart pool that will allow us under time to definitive care to start more or less narrowing down on real ground what we're really looking at. It's a first step. So what we've got a May 25th delivery date. And we actually have quite a few that have come in so far. I wrote Gina in because she was on my call to help me with it. And, what we're getting is it's de-identified, of course, but we've asked the level 1s and 2s for patients coming in and level 3s and 4s for patients going out. And of course, if there's a best practice that falls out of it, that's great. But honestly, it's to look and see where our problem lies. And the thought behind that is to combine these and be able to bring this to the summer meetings and more or less show what we found. And then the next step, it'll probably bleed over to the registry committee because it'll probably be what's the data points we need to dial in with once we figure out what we really need to look at. The follow-up from that is AKI we tabled just because of the amount of people we have to work on it. And the thought is doing pretty much the same thing for AKI once we get the ball rolling with the top for delivery. Other than that, that's where we stand. May 25th, we should have everything. We meet once a month still. We're using the second Wednesday morning. And we've had pretty good turnout that way so far. And hopefully we'll have something to show here. in a couple months.
All right, we got something in the chat from Rama. If John, if you could just send Rama Stevens some info about the meeting, your next meeting. She is requesting to get involved in your committee as well. Thank you.
Hey guys, this is Melissa from Atrium Health Floyd.
Go ahead, I'm sorry.
That's okay. Look, we were unable to be on the last PI call due to a decon train the trainer course. And we were wondering, what is the date range for the information you're asking on that report? We have the report built, but we just don't know what the date range is to pull the data.
Kelly, you wanna answer that?
Well,
I think she's.
we can, on the transfer in, transfer out.
Correct,
So-
yes.
So what we talked about doing was the July to December 2021 data, because that's the data that's not required at this point, and it's just for you to get an idea of what your missing data points might be, or even referral patterns, or barriers that you might see that are obvious from just a data perspective, because in 2022, we know that these data points are now going to be required. And that way, moving forward, we can figure out what the issues are and how we can best assist capturing the data. Does that make sense?
Yes, thank you.
All right, any questions for John?
I have sent you guys the email about, I copied you on it, about trying to get this level 4 PRQ, or not PRQ, but like customized report thing. I have no idea what would be needed for that. So if you guys want to, for your next committee, put it on the agenda, so we can get some people working around. And then the other thing, which is they have their visits, the level 4s, their consult visits coming up in October. So like around the time of St. Simon's, they're going to need to be able to run whatever they need for their PRQ. And I just don't know how many. I mean, Michelle, how good are you guys with the report writer? Sorry, not trying to put you on the spot, but you probably don't use it that much, right?
I don't really use it, just more.
Yeah.
What my question on that is the whole web-based that was discussed earlier. When is that?
So Debbie sent me with the revised quote. She said that they're going to have to send all those quotes to the centers. And then unfortunately, what the web hosting is gonna require is security assessment. So that's what could take a minute on the hospital. Hospital's gonna wanna be absolutely certain, so they're gonna have to jump through all those hoops,
I'll
so.
jump in here a little bit because we're in the middle of that. I put in for the web hosting and the security assessment is, we're
intense.
months out
Yeah,
because of that. And then as far as that goes, and that's
Yeah.
just because I tried to push for it because we were in the changeover from HCA to Piedmont. And so we tried to gather it since we're pulling them off secret servers.
yeah.
And everything, the whole, it's months to get through that. That's just the truth.
So you're asking like the registry and PI group to help develop the PRQ report?
Not necessarily develop like in terms of going in and crafting them in the registry, but like what things would be meaningful for the level 4 for ESO to develop, like, let's say, you know, time to transfer out. Okay, well, it's not just time to transfer out. You need to have patient's medical record number, the patient's last name, that, you know, all the things that you would have in the Excel export that you would do for that report. And some level 4s admit, so for those, then you would need the admit service breakout. It's mostly going to be non-surgical, but like you got to have some, you know, and maybe just like that old pivot report.
Yeah,
Like, remember
just
that
use
old
that.
general?
Yeah, I know.
Hey, Liz.
Yes,
Hey,
ma'am.
this is Tracy. I'm gonna volunteer that John and myself and maybe Kelly and maybe even get Lynn Grant, you know, some people from Therese, because at 1s and 2s, and now, you know, Kelly's a 3, but I don't really have a good feel for what they're gonna need. But, you know, I've already got those PRQ reports, so if we can just kind of come up with a list of the type of reports they need, what they need to report, then it won't be as hard to take existing PRQ reports and just alter them. How
You
does that
guys
sound?
At Morgan, do you have did the PTSF send you guys the PRQ that they want you to fill out before your visit? Did you get that in like a Word doc or a link to it yet?
No, not yet. Send it yet.
Okay, as soon as we get that, I'll send that to you guys, and then you can at least go through that and figure out what it is.
Would that be
you need.
helpful? If you had other people look at it and say, or would you, I mean, I'm just asking, because I know you're
The
busy.
reports that they're gonna require, yes, it would be helpful to have some information on how we gather those reports.
Okay.
You know, what-
So maybe she can, with the 3 of us, we could kind of get a meet time together and just start working on that from the get-go, you know, as soon as she gets it in. And John can arrange the meeting.
And the other thing that we could do is just, because we already have the quote for 5 hours of custom report build time per level 4. So since it's gonna take a while to convert to web hosting, we could just send ESO the PRQ link once we get it from them and just say to them, this is the stuff they have to run, build the reports.
You could do that.
And like,
Yeah.
that'll just get us, that'll just bridge it, right? And then, but then moving forward, once we get past their consult visits, then the stuff that they need to monitor ongoing for, you know, like you want to see who got hypotensive in your ED, who got, you know, transferred out time to transfer, like those kind of things. We can help you think of a few things that you want to run, you know.
So you mentioned the old pivot table reports.
Yeah.
We actually expounded upon that for the
Yeah.
level 3 report, and that made things. Well, when I meet with Tracy at the meeting I'm gonna set.
He said that lovingly, Tracy.
That was with love.
I did. I'm just picking on him because he's in the minority, you know.
I do have the reports I built for that level 3 PRQ, and if that's something we can transfer, that's a possibility.
And that could possibly be worked into like an abstract, you know, working on system stuff. Maybe ESO will pick that up and sponsor somebody to go to their conference next year. John could talk about how we did this.
How many times have you volunteered me today?
But you know, when we do that, they're gonna pay your way, John.
No, that's, that, now we got support, but no, that's,
Okay.
for real, let's do that, because I do, the work's already done. I mean, as far
Yeah.
as building. So why not? Back to the reinvent the wheel conversation.
Right,
or-
yeah, take credit for what you've already done.
Send screenshots to ESO and they can get on the
Right.
phone with them and help them build it.
Because you've already, you said you guys have already paid ESO. to
Well,
do
it's in the
Yes.
amended funds.
So I would say like, let's not use our teams, but
That's
we're
right.
already paying them.
The only thing he needs is the screenshots
Yeah.
of your data elements for the report and how
Right,
you
all I
output
do,
it.
you can go in there and do an edit, we can screenshot that, you'll see
Yes.
exactly what that.
Yes.
The other question is, if you have outcomes, that makes a huge difference as far as ACS.
They'll get it when they get to web hosting, but I venture that most of them probably don't have it right now.
Because that does make. a big
Some of your
difference.
fellow level 3 people don't have it.
I know, but yeah.
So if you're on the phone and you're from a 3 or 4, as soon as you get web hosting, you'll have access to the outcomes module. It comes as part of the package.
Liz, are you gonna have a time frame to say by this date, we would like a center to go ahead and get on the new ESO platform?
Everybody that we currently fund right now is on ESO. So we're gonna have to include it in your language, similar language to your PVP with your verification as eligibility for funding. We're gonna say maintenance of ESO V5, or whatever they're on, at least. for
Right,
the
but
next-
I'm kind of talking more about the new version, going up to the new version.
Tracy?
Oh,
Pardon
the
me?
new-
You talking about the web hosted version? Is that what you're talking about?
Correct.
Oh, yeah, the transition to web hosting is based on the security assessments. Is that what you're?
I think that's what you're asking.
I
right?
think
Tracy,
Tracy, talking
you
about
are-
the new version of V5 that's coming out.
Yeah, you
It's
talked about
already been-
I think she's talking about the web hosting and you guys have already talked about it's hard to say with the IT security, but I guess the question is, should we set a registry?
Tentative goal.
Yeah, they're not really, ESO, Gina has not released anything about that yet, right?
Tracy gave an update on that, on the registry call.
When is,
Are you talking about the new version of V5 or the new?
The new version of V5. And the reason I'm asking is, say, I've got my re-verification survey in April of 23. So I don't want to do anything, but I could start the security assessment and just write very slowly, hoping it'll be done by the time my survey is over. And then, but if we kind of get people set up to say, we would like you to convert by 2023 or the 24 contract year or something, just give them something to shoot for. Just an idea. And then there's been that question that's floated around too about, and I think it came through as an email to trauma program managers about, have you thought about, or when would you go to 2015 AIS? And Garrett's response was, when the state requires it, we'll start pushing it. They have that capability. So I would kind of want to roll that up into that and say, maybe by 2024, we want to use AIS 15. That gives centers plenty of time to prepare for that.
Yeah, Trace, do you want to mention the email from TQIP as well?
So there was an email just asking people, it was kind of just a Survey Monkey thing to say, I think they asked if you use it, when do you anticipate using it? And asking about like, what would make a difference, whether is it supported by your software, required by the state? And then it was only a couple of questions. And the other one was, what percentage of your registrars are AIS 15 trained? And so a lot of them are, I think, but depending on turnover, that might be different. But I think they're only teaching 2015, is that correct? Or are they still teaching 08? Does anybody know? Even if you don't have 2015 training, as long as you've taken AIS coding within the last 3 or 4 years, the update's only a 4-hour course. So those are just things we might want to just keep in the back of our mind and kind of get a long-term goal established for going that way.
This is Robin. You know, they still are offering the 08 training in an abbreviated fashion, but I've taken the 2015. It's a 6-hour course update, and it's really not that different. There's a lot of changes to the spine, but other than that, it wouldn't be that hard of a transition. I really don't think.
All right, so let's kind of wrap up this conversation with what needs to come. So I think to sum up the PRQ discussion, John is going to wait until the team gets their PRQ from ACS, and then you're going to do some screenshots, send that to them, and that's what they're going to
Send
do.
it to me and Gina, and because Gina's been having a lot of conversation with Debbie from EFSO, and then they'll know what they have to build out.
All right, and
I have a feeling that it's gonna be, unless they've done a lot with the PRQ, they do a whole lot of copy and paste from one PRQ.
Right.
And then you have to figure out what's in between. We kind of learned that. So
And
we'll do that over too.
Liz, if we can get Pennsylvania's PRQ for the level 4s, I think I saved Texas's PRQ for their level 4s too, so we can kind of use those
as the guide for
yeah,
the
what are they
performance
asking
stuff
for?
moving forward.
And
yeah.
then we can build, I imagine it's a much smaller, less complicated group of reports that's needed, and we'll just get them what they need.
Pennsylvania's isn't online because their registry automatically imports their data into their PRQ, so there's no report running and filling in.
So when am I gonna work on that? That sounds great.
And looking at the AAAM site, they still offer
08.
AIS 08. It looks like every month. So I don't know what that'll look like.
so it sounds like that some of that needs to probably be, I don't know if we need a separate meeting. I mean, this is probably something we can discuss during the registry meeting, maybe involve some more of the TPMs in your meeting for, a specific time for us to have that discussion. And obviously Marie and we need all the stakeholders kind of there before we can decide as a state. Marie, you have a comment?
Yes, I've requested a quote from Image Trend to see how much it would cost to change the system over in the Image Trend patient registry to receive the 2015 codes. So I'm waiting on that. That will be something that we have to adjust in our contract with Image Trend, because it's not something that they offer state plan.
So
But definitely we need to move forward with it. And I think January 1, 2024 start date is logical. If NTDS, the majority of people say yes, let's go ahead and change.
Yeah, I think that sounds logical too. I think that we, I'd want to make sure we covered everything, but maybe Kelly and that registry subcommittee team can kind of hash it out a little bit more there and make that decision. In case you guys did not hear what Marie said, she will, specifically for the Image Trend site where we are now going to be downloading records, she has asked for a quote from Image Trend to see how much converting to AIS 2015 would be, because that AIS 2008 is what is in their current contract. So she's waiting on a response. All right, so to keep us moving forward, Kelly, you were actually up to talk about registry.
All right, perfect timing. So to kind of dovetail into the GQuip information and with the PI transfer to definitive care being, one of the GCTE goals, one thing that we've done already was create the report on patients that were transferred in for centers to be able to pull that information. They're submitting that information to Gina, looking for trends. And like I explained just a minute ago, I kind of told you what that was about, but the transfer out report has not been developed yet with the screenshot. So you can see all the different information as detailed as I've done the transfer in one. So that should be coming out next week. But look for more of that. The same idea. You're going to look for trends. You're going to look for missing data. What are the barriers to collecting that data? And so that for 2022, we can truly start capturing the information and supplying that information, whether it be to the PI subcommittee or through GQuip, so we can start determining what things we can actually change. On the 2023 registry, we had asked at our last call, our call was the end of April, we asked for any changes to the registry. Through V5, we got some very good information. Gina is the one working with V5 right now in ESO, so she's taken all of that forward. We don't have any information to report back yet, but there are requests for changes that are going forward with that. The last thing we did in our meeting was discuss the 2022 ACS standards and how those relate to registry or registrars. One large component is the change in the standard that says that data inclusion criteria could be state or local inclusion criteria as well as the NTDS, and that they recommend 0.5 FTE per 2 to 300 registry patients. So with that, we created a Survey Monkey that was sent out to the centers to ask several different things. But one thing about, are you adding registry personnel? If so, how many? And based off of that, what's your turnover rate for your registrars? And then we asked some education questions. At this point, it went out through Gina. At this point, we've had 11 centers submit answers. So if you've not done that yet, I highly encourage you to do that, because we really want that information as the registry subcommittee moves forward, so that we can best meet everyone's needs and what they want. We want this to be a working subcommittee. I don't want it to just be everybody listening. So we want to give you what you need. And so hopefully we'll get some more feedback there. That's all I have. We meet again in July.
All right. Sounds like you guys have been busy. All right, so I don't know if Crystal Smith was ever able to join the call. Crystal, are you on? Yeah, she tried to get on, but the Zoom, but I think we've had a few people drop off. But is there anyone else on their subcommittee that would like to provide the report, or would you like me to do so? All right, I'm happy to do so.
Which is a good thing.
You're so accommodating. I try. Talk show business, you have to be. All right, so for our injury prevention and outreach subcommittee, they have been very busy, which is part of the reason why Crystal could not be on at the beginning of this call. As you all know, it is May Trauma Awareness and Injury Prevention Month, and so they've certainly been busy with activities related to those two causes. So first on the report, their goal of increased trauma awareness. So they challenged each of the injury prevention and outreach subcommittees to produce at least one webinar during calendar year 2020. And so they're well on their way to that. Their groups are special events, falls, traffic injury, and intentional injury. As far as Stop the Bleed, they have been continuing to do the Stop the Bleed training blitz virtually across the state. She did state that they had a bleeding control event for colleges and universities. They had over 200 participants. The Georgia Stop the Bleed Blitz is underway with a full day of Stop the Bleed webinars planned for today. Trauma centers and trauma system partners are encouraged to provide Stop the Bleed training during the month of May. And training can be directed to staff members and the community. With the popularity of on-demand and webinar offerings, in-person skills-only courses are needed. And to date, she says, over 2,000 participants in Georgia's trauma system Stop the Bleed webinars. So that's awesome. And then another couple of initiatives they're working on is the Prevent Trauma, the Road Ahead. So working with the Traffic Injury Prevention Task Force, they posted Prevent Trauma, the Road Ahead, which is a peer-led team driving webinar. They did this back on March 24th, and panel discussion featured two moderators from Northeast Georgia Medical Center, a Georgia trauma survivor, teens from Baldwin County High School, teens in the driver's seat team, and deputies from Monroe County Sheriff's Office. There were over 70 attendees from 15 Georgia counties, and 49% of the attendees were teens, 40% parents, and 11% teachers and community members. So I think that was very well received. And if I'm not mistaken, it was recorded and could probably be shared again. They are also working on Prevent Trauma Child Abuse Prevention. We did have an event back on April 27th. And she says our Georgia Trauma System partners from Memorial Health University, Atrium Health Navicent, Augusta University, and Children's Healthcare of Atlanta participated in the panel discussion. There were over 25 attendees from 10 Georgia counties. And then last but not least, all of our favorite subject, Elderly Falls. So they have been doing the bingo size program across the state, bingo size and Falls Free Fridays. So they completed multi-site bingo size cohort on March 31st, 2022. Facilitators included the Middle Georgia Regional Commission, Atrium Health Navicent, Fairview Park, Northside Gwinnett, Kennesaw, and Grady. There were over 125 participants from 10 counties. Northeast Georgia and Memorial Health University also facilitated cohorts this past quarter. So they are doing a great job with that program. And I know in our region that was very well received by some of our folks. So lots of work by the injury prevention group. And does anybody have any questions? If so, someone on the call might have to field those. I know if you want to get involved in the injury prevention task force, Crystal would love to have you. Plenty of work to do. All right, so next up on the agenda, just sort of an old business item, touch base on our GCTE goals and vision. And for any of those of you who are new to the group, this is, I'll kind of just do a real high level reminder of what this is about. But when I took over as chair and Tracy as co-chair, we kind of talked about strategy a little bit for the next 2 to 4 years and what we would like to see accomplished. And so one of the things we wanted to do was sort of align the work of this group with the work of many of the other groups across the state. We felt like historically sometimes GCTE was just sort of grabbing at whatever problem came our way, and there was not a lot of real strategy to it. It was almost like the putting out of fires, and so we wanted to make sure that the work done here was value added and not a real heavy load outside of the work you were already doing at your respective centers and in your region. So for that reason, we decided to work with the group and come up with 3 major initiatives for our state that then the subcommittees could develop goals around and impact these. So 1 was time to definitive care, 2 was decrease our incidence of acute kidney injury, and 3 was increased trauma awareness across the state. So I don't have a lot to report here. I'll just say from my perspective, based on the subcommittee reports, I'm super proud of what we're doing. I feel like all of the groups are really kind of tapping into that and trying to at least address one of those initiatives and do their part to help us reach our sort of system-wide goals. I don't know if anyone has any questions, comments, or thoughts about where we're kind of going with this. Tracy, do you have anything to add here? Tracy, nothing to add?
It took me a minute, I'm a little bit slow. I've been so overwhelmed by John's outpouring of love, but I think we were talking about trying to get some SMART goals, and I'm not sure if we've gotten all those yet. In the injury prevention report, it almost sounds like they had those. So I did send the document to Liz. So maybe if she can pull it up on her computer from her email, that's just what I had. I didn't know. I think everybody's really on target when you listen to the reports from today.
Yeah, I agree. We challenged everyone to do SMART goals. So it was something, that could certainly be real clear and measurable. And so from what I recall, and I text Tracy because I didn't have my computer right in front of me, but from what I recall, I know the education committee did kind of work their 2 goals around in that SMART format. Crystal's team also did that. John's team was still working on it. I think Kelly, you guys made 1 or 2 SMART goals, both of the Kellys, right? Kelly Squared back there, Kelly Squared. So I think that we're working towards that. I mean, as we know, I know SMART goals are meant to be kind of easy, but sometimes it's hard to actually, pinpoint what you really are trying to accomplish. So that hopefully you guys can use that so that over these next few years, we can show, where we started with these ideas and where we got to. So I don't know, did you receive it?
I'm not on, this is Gabby's.
We didn't get it, Tracy.
I don't have it.
And that's okay. I think,
It's all right.
I think we can follow back up with the subcommittees if we have not received a couple of SMART goals, and maybe help shape what they are working on into sharp. We're gonna change it up here. Help them shape- right, SMART goals. Thank you.
Yeah, I think we can. It looks like we've got most everything we need, or we could pull it from today's reports.
Agreed. So I appreciate all of that work, and I know even still, we've asked the subcommittees to do more than just those things. I mean, even in this meeting today, you know, talking about the 3s and 4s and what we might need to pull the registry and PI group into some of that. And so those may not have fallen into those initiatives, but truly, you know, that work is going to actually help with our goal to, for definitive care, to get patients to where they need to be at the right time. So really, it does all kind of tie back. It's just how we kind of phrase it, I guess. Does anybody have any other comments or thoughts about, Gina does actually? Well, I have it, yeah, we have a couple other things, but did you have thoughts about that?
No.
All right.
Jesse, I've got.
Okay, go ahead.
I would just like to encourage, I don't know, Liz, if on your website, all of the subcommittees have their dates for their meetings posted. So going back to Rayma's mention about wanting to get involved in the PI committee, you know, that way that would be a central place to have those dates so they know to, you know, who the committee chair, subcommittee chairs are and the planned dates. That'll help a little bit, you know, if people want to get more involved.
So is there a possibility to put the meeting?
Oh, yeah, of course.
Okay, so as long as you have that information too, Gabby, I would assume enough in advance, she can put that up there.
Tracy, I'll volunteer to send that information.
John, you're just making me cry. I'm so glad I'm not on the video right now.
All right, so a couple more things before we get to like a roundtable. I know Gina had a comment. I had a couple things written down here to bring up as well, but let's talk about this real quick because I know that Gabby sent out a survey. We were asking for some thoughts as far as our meeting schedules moving forward. For most of you who've been around a while, and from when I entered in the trauma world back in, I don't know, 2013, it seemed like most of the time we had the commission meeting in the morning and the GCTE in the afternoon, but as time has gone on, those kind of the logistics of that have become more and more difficult, I think. And so in seeing you guys survey the results and in discussions with the trauma commission team, because first of all, we obviously need them here, but they also support us for this meeting as well. And so we definitely need to make sure we're collaborating and working out the best scenario for all of us. So it sounds to me, and Liz and Gabby, please chime in. We sent there was an email chain this week going around, but it sounds like it's probably going to be best that GCTE and the trauma commission meeting not be on the same day. For those reasons. A lot of times it's just very difficult. The commission doesn't want to, they're not going to start at 7 a.m. and, you know, and then I think that maybe in the past they started a little earlier and then we could get in a little later, but I mean, we're pushing it today and couldn't get a lot of people here, you know, in person because nobody's going to drive 3 or 4 hours and leave at 4 o'clock. So I think if I'm understanding correctly, don't you guys agree that probably going to have to split that up, not on the same day? And what we would likely do is have our meeting, we can make a decision. We'll have it either before so that we can report our most recent work at the commission meeting, or we will have it after the commission meeting so Liz and team can report what was discussed at that commission meeting. So I guess first thing we need to just talk about the August meeting, because for most of us, several of us know that we used to meet in St. Simons. We had all the meetings down at St. Simons. However, room space down there is very difficult to get. And so it does not sound like we're gonna have room space for GCTE during the August meeting this year, correct?
And it's also there's a little complexity going on with the room blocks. It's actually 2 separate room blocks. So I'm a little worried about that. So hence I don't really want to add another meeting.
Right, so, and I think that's fine. I think that we could meet, either, like I said, we could meet before that. I think I might have had a conflict that I sent Liz about. We may have to tentatively look at August 25th for our GCTE meeting. Trying to remember yesterday what I wrote you back. Yes, August 25th is the date that we were looking at. And we would make that I'm fine with making it a virtual only meeting. I do also like us starting to get back in person, so, but we've thrown that
I have a
around.
suggestion for November.
Okay.
If you want to consider this, because, we talked about this morning that Gabby is going to start looking into, we originally have our meeting for November slated for Forsyth at Dipstick. But we may move it to Macon Marriott Center, where we used to have like a lot of strategic planning sessions and stuff, because with PTSF coming to do the aggregate strengths, opportunities, and recommendations, that's an hour in and of itself. So the meeting is now going to be 6 hours. We're going to add a breakfast and lunch. So we think we'll bring people in the night before. Are you giving me grief about a 6-hour meeting? Sorry. I feel it in the background on the back of my head. So potentially, we could do what we used to do, where we come in the day before, have the GCTE meeting in the afternoon, and then the commission meeting the next morning, and whoever comes in person, because that probably wouldn't be hard to get a little room at the, we gotta call and find out availability for this.
Or Tracy could potentially even host us
Oh,
at
yeah.
Madison.
There you go, Tracy. There you go, John. Let's put it right there.
John, would you like me to ask Tracy to schedule a meeting?
Tracy, if you'll schedule that.
John,
meeting.
I've already reserved your room.
This is working well. So what's the date of that one?
That one is November 17th. So we would come in on the 16th.
All right, so let's everybody tentatively, and I think pretty much let's just decide it. November 16th will be the GCTE meeting, and we'll have an in-person option and a virtual option. But it will be in Macon, because a lot of us will want to be there for the commission meeting for that in-depth.
I would love for you to all be there in person for it, because your input will be really valuable, particularly those of you who are from the boards and who are going to undergo those consults. And then we'll also talk about what's going to happen with the January oral focus visit, because that will be our last commission meeting before that will happen.
So with that, I would say if you guys are okay with it, let's go ahead and mark August 25th for virtual only. So we don't even have to worry about room space. And many of us are going to be traveling the week before that anyway for St. Simon. So let's do August 25th. And as far as time, I'm open to, I know we had one in the morning several months ago. I'm fine with morning if you guys are, like 9 to, what do we do, 2 hours? 9 to 11 or 10 to 12 or 1 to 3. Any thoughts? Any cares? You guys want me just to make a decision? All right, let's do 10 to 12 on August 25th. Virtual only. Look at that, guys.
Wow, decisions
made. All right, and we will then address the future meetings past November at a later time, but I think that's good for us. We have the next 2 meetings secured, and
mark the November. We can definitely do it on the 16th. Mark it tentative for in person until we confirm the event location.
Okay. All right, and Tracy, do you want to check a room at Navison, or would you like us to check at the Marriott?
Well, it doesn't matter to me. I think parking would be better at the Marriott, because that's always going to be a problem, and we're not allowed to validate parking tickets anymore. So it's up to you guys. I don't mind. We can get a room. So you guys decide. I'll do whatever.
think that it sounds like it might be easier just to first try the Marriott. So we'll do that. And then if that does not work out, we will come to you begging.
Sounds good.
All right, so then we can move on into our roundtable discussion. I know I'll call on Gina first because she had a, she's super excited about it.
Thank you to Kelly for reminding me about this, because we kind of started this whole project. Something that came up at Barnsley was that we've got a big group now of APPs that are working with our trauma groups and emergency general surgery. So we thought about creating a survey to see if we could kind of make them a little bit of a cohesive group so they could have the opportunity to bounce things off and bring ideas. And I think they would be great partners for us. So I created the survey and then we kind of it got dropped. So I've got some things to add to it. Kelly said she's got somebody willing to lead that group.
Okay.
So look for an email or let your APPs know. We're going to try to, and if you already know someone at your center that you think would be interested or is kind of a lead, you can send me their name and email address and I'll get them to Kelly and we'll get that out.
Awesome. And you read my mind. I had that on my note to say. So I know Kelly had some folks, some of their APPs are probably on the call today. So welcome to them. And I sent it out to a couple of ours. I agree. I think there's a lot of things that group could collaborate on, scope of practice at their trauma centers, training plans, what are the ACS requirements if you're using APPs in your resuscitations and so on and so forth. So I think it's an excellent idea and I hope we can engage them. And like Liz said, is a separate subcommittee? I don't know. Or do we embed them in our own, in the subcommittees we already have and, see where their expertise and input can be valuable to us. So I think that's great to send out a survey and then kind of go from there. But welcome to the ones who did join us today. We appreciate you and look forward to having you in the future. All right. I know, are there any centers on the phone or in the room that recently had a visit, would like to share any celebrations? Kelly's raising her hand.
Oh, wait, I just want to say before Kelly goes, if you weren't here earlier, Jesse received the STM Leadership Award at the annual STM Trauma Con. One more time, girl, I'll get mileage out of that one.
National.
National.
I thought we were gonna let that go. Thank you. Okay,
Congratulations.
Kelly. Thank you.
Jesse, can you hear me?
Yes, we can hear you.
Hey, this is Rayma at Northside Gwinnett. Nadira had to take a phone call, but we did successfully do our ACS verification. We're just waiting for our official announcement from them. We've got about 6 more weeks before they give it.
Awesome. Awesome, Rayma. I heard that you guys had so good for you.
Scottish Rite had their visit April 27th and passed with flying colors. So we're also waiting for our.
So Kelly, in case you couldn't hear on the phone, Scottish Rite recently had their visit, passed with flying colors. They are waiting official word, but not anticipating any issues. So congrats to Scottish Rite, congrats to Northside Gwinnett.
And send the commission office a copy of your verification letter so that we can keep it on file since the verification is coming due for 1s and 2s.
Any other celebrations or things that we should talk about amongst this group? I do want to put in a plug for the ATS webinar tomorrow. It's trauma registry data use in, I can't remember the exact title. How does our registry data impact clinical care? And our very own Linda Green, my very own, love my Linda. Nobody try to take her, Tracy.
Position's open. What's her name?
No, Linda Gibson. So Linda is actually going to be leading the presentation on, I don't remember the time, it's at 2 o'clock tomorrow, and it is free. Even if you're not an ATS member, you can register. And do you think there's any value in me sending that link out to this group today?
Yes.
Okay.
Because a lot of their webinars cost, so people might not have noticed
that it was free.
That it was free.
All right.
Yeah.
I will do that. So if you can jump on there and support, I think it's a really good I've seen the presentation. I think it's awesome. And it really does show where the data that, some of us as the TPMs, what projects we worked on because of that data that our registry team has been able to supply for us. And it, when Linda was asking for examples, I'm like, this spans from increasing staffing to, our pre-hospital blood project. I mean, it goes on and on and on about, the things where our trauma registry data has impacted. So I think we all love our registrars, but let's just show them some support. Show her some support, I guess. All right, anything else for our group today? All right, Tracy, you wanna end this meeting?
Yes, I will ask Gabby, have we forgot to do anything? We got everything approved?
I think we have everything approved already.
All right. Well,
all right, 1 second, Tracy. I'm sorry to interrupt.
Change your mind.
This was hot off the press yesterday. So I was trying to remember when I took over from Karen Hill. She left a little early.
This is important.
Oh, gosh. Yeah, this is a little important. So as you all know, the chair is a 2-year term, and the co-chair is a 2-year term, and then the co-chair moves into the chair role. So surprisingly, my term is over halfway done. There's a fly chasing me in this room, so I'm sorry for you guys who can't see why I'm up
They
here.
can see you doing that.
See, there you are. I don't know what's going on. So nervous about giving this up. I'm kidding. So I think it is the November meeting that we decided we'll need to vote on the new vice chair. Tracy will obviously move into the chair position. And so during the November meeting that we just talked about, which will be great because that will be in person, we will need to have a vote for who will be Tracy's vice chair. And so for the next few months, just be thinking about nominees for that. And if you're interested or if you have questions, I think reaching out to myself or to Tracy to see what all it entails, just to kind of talk it through, would be a good idea. And I know we have a lot of really strong leaders in the state. And so hopefully some folks will step up and be interested. It's a great, I think it's a great career challenge and just a professional growth opportunity. So send names our way. We'll start, we'll make their campaign signs for them. So.
This meeting.
All right, sorry, Tracy. I didn't mean to interrupt you, but that was very important. I do want you guys to be thinking about that. We'll remind you again in August, and hopefully we'll have some names by that time. And then in November, we can actually vote. So now, Tracy, I think it's a good time.
okay. We will adjourn the meeting. Thanks for all attending.
Thanks, Tracy.